The Ontario government is trying to incentivize nurses to stay on the job. Health Minister Christine Elliott announcing today the government is giving eligible frontline nurses up to $5,000 as it tries to stabilize the workforce during this third pandemic year. Eligible full-time nurses will receive a lump sum payment, while eligible part-time and casual nurses will see two installments. The price tag of this program, $763 million, and the money will be given to eligible nurses through their employer. For more on this, we welcome back to CP24 tonight Doris Greenspun, CEO of the Registered Nurses Association of Ontario, and Sarah Fung, co-host of the Gritty Nurse podcast. Thanks to both of you. Sarah, let's start with getting your reaction to this. Is $5,000 enough to keep nurses like you on the job?
You know, I find that it's very interesting the timing that this lump sum came into effect, which is going to be right before the election. And I kind of wonder where the government was last year, even the year before. And really, when you think about it, the wording is up to $5,000, which means that this is most likely going to be taxed. And when you think about the fact that a full-time nurse works about 2,000 hours a year, it really just works out to a couple extra dollars an hour. Is that enough to keep nurses at the front line? I'm not sure. I also wonder if there's any incentive to bring nurses back who have left the bedside or left the profession altogether. So I think this is a step in the right direction. It's certainly very temporary. And I really think that the government needs to look at repealing Bill 124, which is going to be a much more fulsome and comprehensive solution.
So I want to pick up on this point of this being a one-time temporary payment. Doris, the SEIU today calling this a knee-jerk incentive. Do you think this one-time payment will really address the long-term problem, which we know is recruiting and retaining Ontario nurses?
Thank you so very much. I will build on Sarah's comment. Hi, Sarah. The reality is, do we welcome any money? Yes, of course we welcome. It's an acknowledgement to the exhaustion and the selfless giving of nurses for already 25 months. Is it enough to retain nurses? No, and that's why Bill 124 needs to go. And we need negotiations with all the unions. That will help retain nurses. What will help retain nurses, Chanel, is both the compensation and the workloads. The workloads are brutal. They need to absolutely improve, and retaining nurses is essential to opening the door to the many, many that want to come to the profession. To actually do just the bonus alone will not work, and the government is well aware. We are in conversations about many other initiatives. We just need to move forward with them fast and furiously, and we want to see them in each single political party platform.
So, Doris, you mentioned a few things, workload and burnout. Sarah, can you talk more about that? Why are people leaving?
I think at the end of the day, nurses want safe workloads and they want to be able to take proper care of their patients. With the way things are happening right now, being short-staffed, the patients getting sicker, they aren't able to provide the care that we have been trained to provide. And that is really the moral and ethical dilemma. So the payment does help, as Doris said, but really at the end of the day, we want safer and more sustainable work conditions. Nurses are subject to verbal and physical abuse on the job, which the public may not be aware of, and we need something to address this issue as well.
So, Doris, we know you've been pushing for Bill 124 to be repealed for months now, notably no mention of that in today's announcement with Minister Elliott. But if that were to be repealed, how much more could a nurse really make?
Well, I think that the compensation for RNs needs to be significantly increased. Also for RPNs. RPNs are now making almost the same as PSWs. Going back to Sarah's comments, this is a step in the right direction. Let me tell you in real terms, this is about $2 to $3 an hour versus PSWs got significantly more. And let me be clear, we welcome that PSWs got more. It's just that we cannot compress RPNs in the middle with almost the same compensation. And for RNs, we are competing with the US. There is no Bill 124 in the US. Nurses get significantly RNs, higher pay. And we have here, let's remember this one too, over 20,000 nurses waiting to work, ready to come to the workforce. And for that, again, you need the mentors, which is the retention of nurses in the workplace to mentor the new ones that are our internationally educated nurses, as well as we need to bring back, again, the point that Sarah made, bring back those nurses that just retired 2-3 years ago. They can serve as full-time mentors, and they have the expertise and the commitment to do so. So solutions are there, yes. Chanel, let's be very clear. Every single nurse will tell you, we are not giving up. The solutions are there. Government needs to continue to move forward faster than ever before, because as Minister Elliott said, the system, the health system depends on nurses. It's the great majority of healthcare professionals. And so do the people of Ontario and our colleagues that, yet again, I will tell you, they are exhausted.
And when we think about how exhausting this environment is, I mean, do retired nurses really want to come back, Sarah?
That's a great question. I think that there was something called there was a late career nurse initiative, which to my understanding is coming back, but was something that was scrapped earlier. I think that was something that really helped end of career nurses to, work at something that wasn't so physically strenuous. And do they want to come back? I think I'm not sure, because it's really not an environment you want to go back to when you hear that things haven't gotten better. And if anything, they've gotten worse. This is a really dark time for nursing. And I really commend every nurse that has stayed in thus far, because it definitely has been a challenging journey this past 2 years.
Doris, when we think about solutions, how do you see us rebuilding out of this pandemic?
Chanel, this is not the first time that nursing is in this situation. The solutions are there. We have provided every single party and the government with those solutions. Going back to the issue of the senior nurse strategy, it needs to come back. It's going to come back. In addition, we need to bring retired nurses, and yes, many want to come back. One of our expert groups is the Retired Nurses Interest Group. They're quite willing to come back as mentors. They cannot continue to work shifting at nights, et cetera, in the front lines of care at the pace that things are going. But do they want to come back, many of them as mentors, paid mentors? Absolutely, they will. So let the government put the funding, and let's continue to rebuild this profession, because without that, there is no health system. And there is the catastrophic surgical wait times. Just picture that alone, Chanel. Just picture that alone. It is a disaster that people have been waiting 2 years or more for their procedures and surgeries. Yes, there was a COVID pandemic. Now it's time to actually bring back people for those procedures and surgeries. And for that, you need the nurses, and the solutions are there. It is about funding. It is about repealing the bill. It is about negotiations. And it is about all these components together. And we can have a vibrant nursing workforce again, because that's what my colleagues want, and that's what patients need.
Sarah, I want to go back to something you said right off the top, the timing, right? This is an election year. What does Doug Ford, what does his government have to do at this point to make Ontario nurses happy?
I think that it's very interesting when we talk about money, and there's never enough money for healthcare. I think that if you prioritize healthcare and make it your number one priority, you will find the money, you will find the resources. Does the government want to make healthcare the number one priority? That is a question yet to be answered. I think with an election coming up, everybody should do their research on all the different parties, see what their platform is, and see where you see the future of healthcare. Do we want to continue the way it's been going, or do we want to see something different? I would encourage everybody to write to their MP and tell them to repeal Bill 124 and see what their response is, and use that to help you guide your decision as to who you're going to vote for.
Thank you so much for your time, Sarah Fung and Doris Greenspun. We really appreciate this discussion tonight. Thanks again.